Hi, my name is Madison. I would like you to meet my sister Payton. She was born with a rare congenital heart disease called Epstein's anomaly. That means her little heart was deformed.
She had the most severe form of the anomaly, and once it was diagnosed, she was then transferred down to Cincinnati Children's Hospital for further evaluation and treatment. And fortunately, she improved considerably during the 2 weeks in Cincinnati and did not need to have surgery, and her blueness or low oxygen levels recovered spontaneously, and she did very, very well.
As she grew older, so did her challenges. She experienced 2 unsuccessful heart ablations, and she had to take medicine to keep her heart in rhythm. Life was good until...
The cough that started in December and then we didn't know was caused from her heart being so enlarged. It was pressing back on her trachea, which was making her kind of have this gag reflex, which was the cough. The kids would get irritated with her cough. She also had a jugular vein in her neck, and it would just pound. You could see it. And the other kids just didn't understand that. And they would try to tell her, stop making your neck do that. That's really gross. Stop that, Payton. And she would tell him, I can't help it. This is just the way I am.
I would see black spots and I felt I'm going to pass out, and I would try to run 3 laps while the other kids would run 5 laps. And I felt like I was out of shape, and I feel like the kids were like, why is she not running laps? Is she lazy? Does she not like exercising?
The day Dr. Dillon discovered that she needed surgery on her tricuspid valve because she had Epstein's anomaly was a big shock. My whole world just came crashing down. I could not believe that this was happening. In exactly a week from the first ultrasound of her heart, he decided to do another echo, and thank God Dr. Dillon decided to do that other echo, because that's when we found the blood clot.
We're able to treat her with medicines that allowed the clot to dissolve, so we were very fortunate for that. Unfortunately, there was no surgical alternative from which she would recover. That is, the tricuspid valve was functioning so poorly, and her left ventricle was functioning so poorly that the standard type of repair for this type of anomaly was not really an option for Payton. Our recommendation is that she have a heart transplant, and that there really isn't any alternative to a heart transplant.
It was a very long drive to Cincinnati. Lisa and I talked about a lot of things in the car that most parents shouldn't have to talk about. We made some decisions in case the worst case scenario would happen, but it was a long ride home.
It was really scary at first, but it was worth it. One thing that's special about my heart, it's pink and not scaly and old, and looks like an old person's heart. With my new heart, I noticed I don't have purple eggs anymore. I feel thankful for whoever donated their heart to me. I feel a lot better now. I just feel really sad for the family who lost someone, or if they're alone.
Shortly after her surgery, they really wanted to see her. And just, I think in their minds, they wanted to see that she was okay. We worked it out with her dad that we could Skype. So the kids went out and we used my iPad from the school to Skype. That was a big moment for them to see her wearing her, Manning jersey. I remember sitting up and doing well. Made them feel a sense of peace and calm, I think, too, that, okay, she's gonna be okay. What was really cool was after the transplant on March 18th, Payton had her real birthday just 10 days later. So the kids were very excited because she had a birthday with her new heart and kind of a fresh start at life, and they were just as excited to have her real birthday shortly followed up.
I try not to think about what things would be like if Payton would have not made it or if she's not in my life. I want to thank the Heart Association for saving the lives of the people I love, and without it, my sister may have never had another chance.
Thank you to the American Heart Association for taking care of my heart.
I love you, Payton.